Hey, you are watching AliAziz YouTube channel.
Top 20 Certified Nursing Assistant (CNA) Interview Questions and Answers for Fresh and Experienced Candidates. 1. Mention what is CNA. A CNA stands for Certified Nursing Assistant. It is a person who has received training to help patients under the close supervision of a licensed practical nurse or a registered nurse. 2. Mention how to become a qualified CNA. To become a qualified can 1. Complete state-approved education program. Pass state-approved education program. Check local regulations before enrolling since CNA training vary by state. CNA programs last from 4 to 16 weeks. 2. Pass state-specific examination. Pass a state-specific examination to be fully certified. Graduates can work up to 4 months without certification while waiting to take the exam. 3. Get your first job. Certified nurse assistants can only practice under the supervision of licensed nurses. It is illegal to offer their services as independent providers. Continue some states mandate. CNAs must fulfill education credits each year to maintain their qualifications. 3. Mention what are the job responsibilities of a CNA nurse. Job responsibility of a CNA nurse include provides patients personal hygiene like back rubs, shampoos, shaves, bedpans, urinals, baths, assisting travel to the bathroom, and so on. Other activities include serving meals, feeding patients, ambulating, turning and positioning patients, etc. CNA should also give medical help like administering enemas, non-sterile dressings, douches, surgical preps, heat treatments, ice packs, sits and therapeutic baths, applying restraints, etc. Restock rooms with necessary supplies and change bed sheets. Take patient vital signs, testing urine, weight check, recording intake and output information. Transporting patients, answering patients' call lights and requests, reporting observations of the patient to nursing supervisor, documentation and maintaining forms, logs, reports, and records by following policies and procedures. Maintains work operations like keeping patient information confidential, participate in educational opportunities, maintaining licensure, reading professional publications and so on. Serve hospital community by adhering to professional standards, hospital policies and procedures, federal, state, and local requirements. And JCAHO summon emergency assistance in the hospital. 4. Mention what are the common challenges a CNA may face. A common challenges a CNA may face include dealing with difficult patients and their demeanor, managing smooth transition of shifts, avoiding conflicts with coworkers, lack of help from coworkers, convincing patient and politely denying unreasonable requests. 5. How you deal with a patient who is aggressive and resist for medication. To deal with patient who is aggressive and resist for medication, my first approach would be I would make patient calm and administer the drug. If that didn't work, then I would make sure that he is safe and I would ask for help. 6. You will have several patients to take care of. How do you prioritize which one you attend to first? I would assess the list and organize them in order of urgency as per their medical needs. 7. What are all places a CNA can work? A CNA can work at following places: nursing homes, home health care agencies, assisted living facilities, staffing agencies, hospitals, hospices, doctor offices, practice groups, day care centers and schools, medical clinics, urgent care centers. By federal law, CNA are mandatory at nursing homes. 8. Mention medical skills a CNA must possess. A CNA must not require a highly sophisticated medical skills, but they should know in emergency what to do, like to perform cardiopulmonary resuscitation if a patient is having heart attack or breathing problem, should know how to use pressure to stop bleeding, what to do when unconscious patient suddenly begins to vomit. 9. Give details about the CNA licensing exam. The CNA licensing exam is taken in 2 segments. The theoretical portion includes questions about patient procedures, protecting patient privacy and other information you covered in your lectures, textbooks, and workbooks. It is written portion of the licensing exam. The second part of the test is a clinical portion, where you need to practically demonstrate all tasks on a model patient. 10. Mention what is the difference between CNA and nursing assistant. The difference between CNA and nursing assistant is that CNA tends to provide bedside care to senescent patients, while medical assistants assist more with procedural or administrative preparation and housekeeping. 11. When your CNA license is liable for inactivation. Your CNA license is liable for inactivation if you do not work for at least 8 hours for pay in the province. 12. What is your 5-year plan as a CNA? As a CNA, mention a plan like pursuing a bachelor degree in nursing or some advanced course related to CNA. This shows that you aspire for RN, registered nurse. 13. Mention what you do if you notice a doctor or a nurse not doing their job. When you see a doctor or a nurse not doing their job, you should follow protocol and report the person through the proper channels. 14. While doing a lateral side transfer for patient having different weights, what will be your approach? For lateral side transfer for patient having different weights, say for patient less than 100 pounds, use a lateral sliding aid and 2 caregivers. Patient having greater than 200 pounds weight, use a lateral sliding aid or mechanical lateral transfer device with 3 caregivers. 15. Mention for what patient height adjustable shower gurney or lift bath cart with waterproof top is used. Height adjustable shower gurney or lift bath cart with waterproof top is used for a patient who is unable to sit up. 16. Mention what is the proper term for an infection that is transmitted during a medical procedure. The proper term for an infection that is transmitted during a medical procedure is iatrogenic. 17. Mention what is the measurement of the pressure in a patient's heart during contraction. During contraction, the measurement of the pressure in a patient's heart is referred as systolic blood pressure. 18. Mention what is the meaning of assault and battery in CNA practice. In CNA practice, assault is referred to physical violence or threat to use violence against someone. Battery is actually referred for physical violence or wrongful touching against someone. 19. While measuring blood pressure, what you need to check as a precaution. As a precaution, while measuring blood pressure, you need to make sure that you don't take a BP on an arm with an IV. 28. Mention how a CNA can become lane licensed nurse. A CNA can become lane licensed nurse. Need as many as 200 hours of additional education in some areas like pediatrics, maternal medicine, and gerontology. Need experience in a hospital, clinic, or private practice that you can use toward your license. Need to pass the national NCLEXPN exam to work in a hospital setting.